Okay, so I've not been doing too well lately, so sorry for the appearance, and I'm going to go ahead and start going over some information that I just put on my website. The first one actually is going to have to do with pregnancy and lupus. And of course, all this information comes from research that I have done. I actually got this off of the webmd.com website. And if you have any questions, do talk to your personal physician about it. My site is basically just for information, not for general, not for personal advice or anything. About 20 years ago, a medical textbook said that women with lupus should not get pregnant because of the risk both to the mother and the unborn child. But today, most women with lupus can safely become pregnant now. With proper medical care, there can be decrease in the risk associated with the pregnancy and deliver a normal, healthy baby. To increase the chances of a happy outcome, however, you must carefully plan your pregnancy. Your disease should be under control or in remission before conception takes place. Now, getting pregnant with your disease, when your disease is active, could result in either a miscarriage, stillbirth, or serious complications for you. It is extremely important that your pregnancy be monitored by an obstetrician who is experienced in handling and managing high-risk pregnancies, and who can work closely with your primary doctor. Delivery should be planned at a hospital that can manage a high-risk patient and provide the specialized care that you and the baby would need. Do be aware that vaginal birth may not be possible. Very premature babies babies showing signs of stress and babies of mothers who are very ill will probably be delivered by a C-section, cesarean section. One problem that can affect a pregnant woman in development of is a development of a flare. In general, flares are not caused by pregnancy. The flares that do develop often occur during the first or second trimester, or during the first few months following delivery. Most flares are mild and easily treated with small doses of corticoid steroids. Another complication is pregnancy-induced hypertension. If you develop a serious condition, you will experience a sudden increase in your blood pressure, protein in urine, or both. Pregnancy-induced hypertension is a serious condition, and that does require immediate treatment, usually including the delivery of the infant. The most important question that pregnant lupus patients ask is, will my baby be okay? Well, in most cases, the answer is yes. Babies born to women with lupus have no greater chance of birth defects or mental retardation than do babies born to women with lupus. As your pregnancy progresses, the doctor will regularly check your baby's heartbeat and growth with sonograms. Now, about 25% of lupus pregnancies end in unexpected miscarriages or stillbirths. Another 25% may result in premature birth of the infant. Now, although prematurity presents a danger to the baby, most problems can be successfully treated in a hospital that specializes in caring for premature newborns. About 3% of babies born to mothers with lupus will have neonatal lupus. This lupus consists of a temporary rash and abnormal blood counts. Neonatal lupus usually disappears by the time the infant is 3 to 6 months old and does not reoccur. About 1/2 of babies with neonatal lupus are born with a heart condition, though. This condition is permanent, but it can be treated with a pacemaker. Planning your pregnancy. Now, you and your spouse or partner should talk to your doctor about the possibility of pregnancy. You and the doctor should be satisfied that your lupus condition is under good control or in remission. Your doctor should also review potential problems or complications that could arise during the pregnancy, their treatment and outcomes both for you and the unborn child. You should select an obstetrician who has experience in managing high-risk pregnancies. Additional experience in managing women with lupus is also good. The obstetrician should be associated with a hospital that specializes in high-risk pregnancies, deliveries, and has the facilities to care for newborns with special needs. It is a good idea to meet with the obstetrician before you become pregnant so that he or she has the opportunity to evaluate your overall condition before conception. And this meeting will also give you the opportunity to decide if this obstetrician is right for you. I'm checking my time, sorry. You should also check your health insurance plan. Make sure that it covers your health care needs and those of the baby and any problems that may arise. Review your work and activity schedule. Be prepared to make changes if you're not feeling well or need more rest. Consider your financial status. If you work outside your home, your pregnancy and motherhood could affect your ability to work. Develop a plan for help at home during the pregnancy and after the baby is born. Motherhood can be overwhelming and tiring to begin with, and even more so for a woman with lupus. Although most women with lupus do well, some may become ill and find it difficult to care for their child. I'm going to go ahead and stop this video here and go ahead and do another one so I can finish up the information that I want to give you guys.